Hi there. My name is Andrew Vandenberg. I'm currently a second year physical therapy student at Campbell University, as well as a licensed athletic trainer. Welcome to my 5-part video series on how to perform VOMS testing and how to prescribe exercises for return to sport afterwards. I hope you enjoy. All right, so the first test that we're going to perform is called the Smooth Pursuits test. It's pretty easy. You don't need any equipment for this. You stand about 3 feet away from your athlete here. You're going to start your finger about their eye level. And again, they're just going to follow your finger as smoothly as possible without breaking off the finger. They can still blink and stuff like that. And so what I would instruct Anna, I said, Anna, just follow my finger, the tip of my finger with your eyes and your eyes only. And so you do 2 passes horizontally at a relatively slow speed and 2 passes vertically at a relatively slow speed. What you're looking for is, especially at end ranges, you're looking for any sort of nystagmus, and you're also looking to see if they skip at all along the path, because once you do it once, they can anticipate where the finger's going to go, and sometimes their eyes will jump in front of it here. Perfect. And then once you finish the test, just like every other part of VOMS, you ask them about their 4 symptoms, and I'll ask Anna right now, do you have any headaches with that?
No.
Any dizziness with that?
No.
Any sort of nausea?
No.
Any sort of fogginess?
No.
Perfect. And that's how you perform the Smooth Pursuits test. All right, so we can see here as Anna does her Smooth Pursuits, as her gaze goes towards her left or the right of the screen, you can see some small, low beating nystagmus as she's moving her eyes horizontally. As she moves her eyes vertically, you can see a little bit of a unsmooth path, but otherwise she looks pretty good with those there. So those are just some of the irregularities you might want to look out for with Smooth Pursuits. And again, I'll loop the video back so that way you can see some of that nystagmus again, in case you missed it the first time. So for our first exercise recommendation for Smooth Pursuits, we can obviously just perform the test itself to become better at it. However, I feel like this basic test lacks a little bit of dimension, and especially when we talk about returning an athlete to sport, they're going to need to be able to trace more than just horizontally and vertically in one plane at one time. So you can see here I've drawn out a rather large star on a whiteboard. And what I have Anna doing is doing a series of following the outlines in the edges of the star, starting from 1 and moving all the way to 5. After a few seconds, you can call out a different number for her to start on, or instruct her to go backwards too, to work on lots of different facets of it. To make it easier, you can make the star smaller, so that way her eyes have to cover less distance. To make it harder, you can move her closer, or make the star bigger, so that way her eyes have to cover more distance. And that's an example of an exercise I would give to improve an athlete that has deficits with Smooth Pursuits testing.